This is Dr.RED Panda.
In the 1940s, thousands of patients had part of their brain destroyed, not as punishment, not as an experiment, but as treatment. Doctors believed this would make people calmer. Families believed it would bring loved ones back. And the man who made it famous won a Nobel Prize for it. The question isn't how this happened. The question is why it felt like mercy at the time. I'm Dr. Red Panda, and this is one of the darkest moments in medical history. A cure the world applauded. In the early 20th century, mental illness was not something society knew how to handle. Hospitals were overcrowded. Asylums were overwhelmed. Families were desperate. There were no modern antidepressants, no antipsychotics, no reliable therapies. If someone suffered from severe depression, schizophrenia, or uncontrollable anxiety, the options were limited and often brutal. Restraints, isolation, sedation, institutionalization for life. Doctors were not villains in white coats. They were exhausted. They were facing patients who screamed for hours, who harmed themselves, who could not sleep, who terrified their own families. And they had almost nothing that worked. So when a Portuguese neurologist named Antonio Egas Muniz introduced a new surgical procedure in the 1930s, it felt like a breakthrough. The idea was simple. If certain parts of the brain were responsible for overwhelming emotion, perhaps severing the connections to those areas could calm the patient. Not kill them, not punish them, calm them. Early reports were optimistic. Patients appeared quieter, less agitated, more manageable. Some were even described as improved. Newspapers began calling it revolutionary. Hospitals began adopting it. And within a decade, thousands of procedures were performed across Europe and the United States. In 1949, Muniz was awarded the Nobel Prize in Physiology or Medicine for this discovery. That detail matters, because history often reassures us with a simple narrative. If it was wrong, surely people would have known. But they didn't. At the time, this procedure was not hidden in secret labs. It was presented at conferences, published in journals, celebrated in headlines. It was seen as compassionate. To understand why, you have to place yourself in that moment. Imagine watching someone you love trapped in relentless psychological torment. No medication helps. Institutions are full. Doctors shrug in uncertainty. Then someone offers a procedure that promises relief. Not perfection, just relief. And after the surgery, the screaming stops. The pacing stops. The violent outbursts stop. The patient becomes quiet. In an era defined by suffering and limited tools, quiet looked like progress. Calm looked like healing. And that is the uncomfortable truth. When the baseline is chaos, even drastic measures can feel merciful. No one thought they were erasing personalities. No one framed it as destroying identity. They believed they were reducing pain. That belief, sincere, institutional, reinforced by authority, is what allowed the procedure to spread. It wasn't driven by cruelty. It was driven by hope. And sometimes, hope can be far more dangerous than malice. Because malice knows it is doing harm. Hope convinces itself it is doing good. And that is how one of the most controversial procedures in medical history became not only accepted, but applauded. When treatment became a factory. Once the procedure was accepted, speed replaced caution. What began as a careful neurological experiment slowly transformed into something else entirely. A system. Hospitals were drowning in patients. Doctors were judged not by long-term outcomes, but by how quickly they could restore order. Administrators wanted efficiency, and lobotomy delivered exactly that. The operation was fast. It required minimal equipment. And most importantly, it produced immediate behavioral change. Patients who once cried, argued, resisted, or terrified staff became passive. They stopped complaining. They stopped demanding. They stopped being difficult. And in an institutional setting, that silence was interpreted as success. Soon, the procedure no longer belonged only to neurosurgeons. In the United States, one doctor in particular transformed lobotomy into a mass-produced solution. He simplified the technique so drastically that it could be performed in minutes, sometimes without anesthesia, using a tool resembling an ice pick. The method required no operating room, no sterile environment, no long recovery, just a quick insertion through the eye socket, a few controlled motions, and the brain's frontal connections were severed. Patients were often awake. Some were children. Some were housewives described as too emotional. Some were teenagers labeled defiant. Some were simply inconvenient. Consent was vague. Records were rushed. Families were reassured. Doctors told them the same thing again and again. They'll be calmer. They'll be easier. They'll be happier. But calm is not the same as well, and easier is not the same as healed. As the numbers climbed into the tens of thousands, something became impossible to ignore. Yes, patients were quieter, but they were also diminished. They lost initiative. They struggled to plan. They stopped caring about things they once loved. Some could no longer hold conversations. Some became childlike. Some sat for hours, staring at nothing. Their suffering had not vanished. It had been flattened. And yet, the system rewarded this outcome. Hospitals reported fewer incidents. Staff workloads decreased. Families described patients as manageable. From the outside, it looked like progress. Inside, something essential had been cut away. The most disturbing part is this. Many doctors noticed. They saw the side effects. They documented the personality changes. They observed the loss of ambition, creativity, and emotional depth. But the question quietly shifted. Not, is this person whole? But, is this person disruptive? Medicine, under pressure, began optimizing for order rather than humanity. And once that shift happens, the line between care and control blurs frighteningly fast. Lobotomy stopped being a last resort. It became a shortcut, a way to silence pain instead of understanding it, a way to manage people rather than help them. By the time serious criticism gained traction, the damage was already irreversible. Tens of thousands of people had undergone the procedure. Entire wards had been transformed, not by recovery, but by compliance. The patients were quieter. The institutions ran smoother. And the numbers looked good on paper. What disappeared did not show up in reports. Motivation, curiosity, emotional depth, the messy, inconvenient traits that make a person fully human. These losses were rarely recorded as failures. They were reframed as acceptable trade-offs. And once those trade-offs became routine, the practice no longer felt extreme, felt normal, not because it was harmless, but because the system had learned how to live with the damage. The comfort of control. The most disturbing part is not that this ever happened. It's that nothing fundamental had to change for it to happen again. The logic behind it never disappeared. It simply learned to wear cleaner clothes. Back then, the goal was stability. Patients were described as too emotional, too difficult, too disruptive. The solution was to make them quieter, more manageable, easier to supervise. Today, we use softer language. We talk about optimization, productivity, emotional regulation, risk reduction. But the underlying question is the same. What kind of human behavior are we willing to sacrifice for order? When discomfort becomes a problem to be eliminated, any tool that promises relief starts to look reasonable, even irreversible ones. What made the system dangerous wasn't cruelty. It was consensus. Doctors agreed. Institutions approved. Families consented. And society rewarded results. No single person had to feel like a villain. Everyone was simply doing their job. That's how damage becomes invisible. Not through malice, but through normalization. And normalization is powerful. Because once something is normalized, questioning it feels irrational, even unethical. History didn't move on from this logic. It refined it. Control no longer needs ice picks or operating rooms. It works through expectations, metrics, algorithms. labels that quietly decide who is functional and who is a problem. We still design systems that prefer calm over complexity, compliance over curiosity, predictability over depth. And when those systems succeed, we call it progress. The uncomfortable truth is this: a society does not need to be violent to be dehumanizing. It only needs to decide which parts of being human are inconvenient. Once that decision is made, everything else becomes a technical discussion. This isn't a warning about the past. It's a mirror, because the real question was never whether the procedure worked. It did. The real question is whether we've learned to recognize the cost. Before the paperwork looks impressive, and the silence feels like success. And that's a wrap for this episode of the video. I'm Dr. Panda. If you found this video helpful, don't forget to subscribe and give it a thumbs up. Until next time, take care.